Okay,
So
sir.
today we will discuss some two, three topics. One is counseling for these patients with chronic illness, then counseling for anxiety and depression. These are some topics we will discuss today. Uh, see, illness. Generally, this illness maybe it is normal, it is moderate, or you can say some sort of chronic illness. Okay, some illness, maybe some sudden this incident like maybe some accident resulting of some accident or sudden system of illness, maybe with some developmental delays or chronic illness, maybe. Okay. So here, illness, the reasons of illness may be vary from one place to another place, one person to another person. There are some common type of chronic illnesses. Yearly, we have sudden onset disabilities. Sudden onset disabilities means due to some accidents, some sort of issues may be arised with their physical aspects. So the disability may be happened with the sudden onset of the issues. That is number one. Number two is health related issues. Illness may be uh, two health related reasons. Some sort of neurological and neuromuscular disabilities. These are the some type of illness or some sort of issues related to the chronic illness. Okay. Then if we have any patient related to this type of illness like cardiovascular disease, cerebral vascular disease, kidney issues, liver issues, some sort of Alzheimer's dementia issue, epilepsy, hereditary factors, some sort of issues related to the that is orthopedics like orthopedic issues. So some sort of ulcer type of issues, maybe some sort of back pain, back and spine impairments. So these are all various type of health issues, or you can say chronic illness in any cases. Okay, how to deal with the chronic illness? One is that managing medical crisis. Okay, whenever these sudden sort of illness or the chronic illnesses happen to any individual, so medical management is the most important aspect. Medical management means how to take the patient to the doctors, what are the various financial aspects. So these are all the things we had to check. These type of issues we need to give in counseling procedures. Number two, how to controlling the symptoms when you take the person to the medical doctors or medical treatments. So medical crisis is one thing. Second is controlling the symptoms. What are the symptoms observed in the medical treatment or medical procedures? How to control the symptoms? That is also one important aspect we need to check when we are giving the counseling. One is they will come to the counselor, they'll come to the counseling procedure to manage the medical crisis, number one. Number two is in order to control the symptoms. So maybe medical management, medical doctors' advice may be there, but still, how to control the symptoms of these issues, they will come to the counselor. So, what are the various treatmental procedures? That procedures, generally what happens in the medical doctors, they won't give full-fledged information about the case, about the issues, about the symptoms, because of their time concerns. Okay, so that is the reason some other doubts they will come to the counselors. For example, if they are not not they are not giving proper information from the doctors, they don't have proper information from the doctors. Again, they'll proceed the counselors. So these are the advice given by the doctors how to follow this advice. So that is one important aspect you will find in the counseling process of the illness, that is chronic illness patients. Then how to coping with an uncertain prognosis, some sort of prognosis, uncertain issues may be happened in this cases. So in that issues also, you better to give the counseling to that particular cases. Then how to adjust to the situation. So in some cases, the situation may be different. They don't even expert that type of situation. In that situation, how to manage that situation. Okay. So adjusting the situation, adapting to the situation. That is also one thing we need to handle in our counseling procedures. Then what are the what is goals you have to achieve in that counseling process of this chronic illness. Okay, we have to set a goal. For example, any developmental issues, maybe children or any adults and cases. Like some children may be insulin dependent diabetes. Okay, some children may be impaired social relation with the peers and siblings. Some children may be having some sort of that is emotional issues, adjustment with the families, especially in the adolescent cases. You can easily find this type of cases like adjustment with the families. In adolescent case, what happens when they entered into the adolescent stage? So maybe with some sort of sudden changes in their physiological as well as the psychological aspects. So they will have some sort of disturbances, emotional disturbance cases. So in that cases, how to adjust with their emotions, how to manage their emotions, those things also we have to check in the counseling procedures. On chronic illness in the adulthood also, chronic illness in young adulthood, chronic illness in the middle age group, chronic illness in the aged persons also. So in the chronic illness cases, as I mentioned, medical management, financial aspect, family adjustmental issues, some sort of coping strategies we have to develop, some type of advice related to the symptoms that also may be from the doctors and even from the medical professionals, in the psychological professionals also, we have to give some counseling procedures, some counseling tips. Okay. And caregiving is another important aspect. Caregiving means whatever the persons or the family members, they need to give some sort of care that is known as the caregiving. Even with the caregiving also, their financial aspects, caregiving is not that much easy. They need to have some sort of these patients when you are then they are giving that caregiving. For example, there is any aged persons, some sort of chronic illness is there. So providing caregiving is not that much of easy. So they'll have some sort of financial stability. Then patients and caregiving burnout also one important thing. Caregiving burden. Okay, and self-care also. Self-care of the caregiver. For example, any chronic illness is there with the patient. So caregivers also need to take these some precautions. So that is self-care for the caregiver. It is, for example, some issues may be communicable issues. In that case, caregiving is not that much of easy. So better to take the self-care for the caregivers also. Supporting services. We need to, as a psychological professional, we need to know what are the supporting services to this particular cases, maybe supporting service, many rehabilitation services, any social support, and any other support from the other social member or siblings or any other members in the society. Those things also we have to check and we need to give the information to the persons. Okay. So caregiving is support, caregiving is burden, caregiving is self-care. And these are all various issues we need to check when the patient is having some sort of chronic illness. Then, for example, if the person maybe aged person, above 60 years of age person. So in that case, if sudden any, if they have knowledge of any sudden issues in their health or any chronic illness, what will be their that is psychological condition? As I mentioned the previous class also, one is shock. They will be in shock after knowing that this illness. For example, doctors show the reports, or this is your report. So this is your condition, health condition. First of all, they will be in a shock. So second is denial. They won't accept it. No, no, it's not my report. Maybe some wrong report. Maybe that is not my report, mistakenly or any. other report, maybe this. Because I am healthy person, I am doing my daily routines. So that is the reason they won't even believe it. First of all, they shock. The second is denial. They won't accept it, and they will blame the doctors and other professionals also because they don't know how to do the reports. They don't have proper knowledge of these particular issues. They don't have proper studies in this particular. That is the reason they'll blame the persons. So here and grief, sadness. Okay. So first of all, just we need to understand which is the condition. What are the condition of the cases? What are the condition of that particular client or the subject or the individual? So in any way, we need to give the proper counseling procedures. So here, when the person is not in a position to accept it, acceptance is another important major task in the counseling process. Okay, so here maybe the caregivers or the family members, maybe the first patient also, patient having the chronic illness. So identifying the status, present condition of the patient. Okay, so as I mentioned, counseling to the patient with the chronic illness is, first of all, we have to find out the reasons of the chronic illness, number one. Number two, which type of chronic illness. Number two, then, so how to manage this financial aspect, medical crisis, then how to control the symptoms of the case, and how to develop the coping strategies with this case, and how to adjust with the other family members in the case. These are the various goals we have to set, and slowly, we need to identify the status or stage of the case. So even the children and the adolescent also. Okay. So child-related cases, maybe developmental milestone delayed, and the adolescent case of adjustment issues, emotional issues, and some sort of emotional adjustment, physical adjustment of family members. These are all the various issues we need to identify. So, and then what are the stages of the case? The stages may be in the shock, the stage may be in the denial, maybe blame, grief, not acceptance. So, these are all the various stages. So, when we see the case, you can easily identify which stage they are. So, depending on the stage, depending on their capabilities, depending on their various aspects, so we have to provide a count. Then another important, as far as I mentioned, caregivers, caregiving also another important area. We have to provide the counseling. Caregivers issues like caregivers burnout, caregivers adjustments, also, caregiver self-care. Okay, supporting services from the caregiver, supporting from the social support, supporting from the rehabilitation services to cope up with the issues. So these are all the things in our counseling we have to give to the persons feeling with some sort of chronic illness. Then maybe some sort of anxiety and that is distress. So here, for example, anxiety and the depression. So first of all, the person is in the anxiety situation or not, what are the various anxiety symptoms that we have to check? Anxiety means some symptoms you have to check, like apprehensiveness, fearing some this unspecific specific one, generalized anxiety, or some sort of somatic features like palpitations, then some sort of depersonalization, some sort of pain related. So here, these are all the various symptoms we have to check. So in the cases of the cases having some anxiety related issues. For example, the anxiety also different type of anxiety, like specific anxiety disorder, then it is generalized anxiety disorder. For example, specific anxiety means specific phobia, like social phobia, hydrophobia, then hydrophobia. These are all some sort of specific anxiety disorder. Some cases may be having generalized anxiety without any specific things, generalized anxiety disorder. So whether it is a specific anxiety or the general anxiety cases. So then some sort of panic disorders, panic issues. Okay. So panic issues maybe reason maybe some sort of hello.
Yes, sir, you're audible.
Then obsessive compulsive disorder, OCD. Then PTSD. What is PTSD?
Trauma, post-trauma something.
Yeah, PTSD means post-traumatic stress disorder. Post-traumatic stress disorder. Post-traumatic stress disorder. PTSD. OCD means
Oppressive.
obsessive compulsory disorder.
Yeah.
Obsessive compulsory disorder. OCD. OCD, PTSD, GAD. GAD means generalized anxiety disorder. Panic disorders. Specific phobic cases. Okay. Some sort of anxiety disorder without any reasons, as I mentioned, journaling. So here, related to the anxiety, there are different type of issues. So we have to check whether it is GAD. GAD means without any reasons. They don't have proper reason, specific reason, but for every issue, they will feel some sort of anxiety. So generalized anxiety, GAD. Second is specific anxiety disorders. Specifically, for only for specific reasons, specific issues only, they'll have anxiety. Then, as I mentioned, the obsessive compulsive disorder. Obsessive compulsive disorder means OCD. Obsess Due to their obsessive thoughts, they will do some sort of compulsory activities, compulsions, compulsory activities. What, for example, they feel that they have some sort of dead particles on their hands. That is obsessive thought. Okay, because of their obsessive thoughts, they will do some compulsory activities. Means repetitive hand wash. Repetitive hand wash is a compulsory activity. By doing that repetitive hand wash only, their anxiety will be reduced. Without doing that repetitive things, by doing the repetitive things, their anxiety will reduce. Okay. What is the reasons of that particular repeated activities? We have to find out. That is some sort of obsessive thoughts. Obsessive thoughts leads some compulsory activities or repetitive activities. If you want to stop the repetitive activities, we have to address with the compulsory activity. When that is obsessive thoughts are reduced, then only it is possible to reduce compulsions. As I mentioned, repeated hand wash is the compulsory activities. The reason of the repeated hand wash means their obsessive thought, that is this, they have some sort of dirty particles on their hands. The dirty particles are deposited on their head. That is the obsessive thought. So that is dust particles on the hands is a common one. Even in our hands also, dust particles will be one way or other way. But they'll feel that due to that is obsessive thought, the compulsory activities they do. By doing that compulsory, when they do the compulsory activity only, the anxiety will reduce. So there are so many techniques of these that is obsessive thoughts related to OCD cases. One is systematic desensitization for the phobic case. For the phobic cases, systematic desensitization, sensitization, desensitization, systematic desensitization in the case of these phobic cases. For OCD cases, ERP, exposed response prevention. Exposure response prevention. That is the best technique of OCD cases. Exposure response means, for example, they have a feeling of that is repeated hand wash. Or, for example, when they see the dust particles, when they see the dust bins, when they are in the that is some sort of polluted area, their anxiety will be high. will reaches the maximum extent. So what to do? One is systemic desensitization or ER, expose them to the same situation. Though they have some anxiety in that polluted area, better to ask them to stay for few seconds or few minutes initially. Hierarchy we have to maintain means initially ask them to stay for 3 minutes in the dust area, in the polluted area. When they reach that place, automatically their anxiety will reaches its peak. Though the anxiety may be high, better to ask them to stay for 3 minutes. When the moment they enter into the place, their anxiety will be reduced. But the time starting may be high, the anxiety will be high, but slowly will reduce. For example, 10 points anxiety when they reach the place. If they stay for some time, slowly, that anxiety reduces in the first instant, first time, first stage, first occasion, or first session. Give some gap, again take them to the same polluted area, dust polluted area or air polluted area. Again, they'll when they reach the place, automatically their anxiety will be high. Yeah. So again, keep them. Now, initially, first session, 3 minutes only. Now ask them to stay for 5 minutes. So here, anxiety, whatever the anxiety they feel in the initial stage, that may not be now. That anxiety will be reduced now. So repeatedly you have, that is the reason hierarchy. Initially, you have to stay, you have to ask them to stay for only a few minutes. Then slowly, better to increase the time. Slow, automatically anxiety will reduce. So this is known as the ERP, exposed response prevention in OCD cases. And same I mentioned this, if it is specific phobic cases, in specific phobia cases, systematic desensitization, then systematic desensitization. Whatever they feel that is sensitizing, we need to desensitize that. Unsystematic, for example, if the heitophobia is there, they feel with the heitophobia, like heights, when they reach the height places, so automatically their anxiety will be high. So that is the reason, again, here also, systematically, we need to give the sessions, or you can say procedures. Initially, ask the client to reach first floor. When they reach the first floor, the moment they reach the first floor, in case of heitophobia, their anxiety will be high, will be in the maximum level. Even though it is in the maximum level, the anxiety will be high. So ask them to stay for some time in the same situation and give some sort of relaxation techniques. They need to think that why I am feeling so anxious. Nothing is happening here. That is the reason you need to train this case. You need to counsel the case in that situation where he or she felt so high anxiety in the first floor. Then after that particular 10 to 15 minutes time, ask them to come to the normal place. 2 or 3 sessions we have to take in this stage of first floor, in this stage. Then after 3 sessions, ask them to reach the second floor. The moment they reach the second floor, automatically the anxiety will be high. The anxiety reaches its peak stage. So ask them to stay for some time. As I mentioned, the ERP case, that ERP is for OCD cases. The systematic desensitization technique is for phobic cases. So here in the second floor, again, ask them to stay for some time, now around 15 to 20 minutes time. Then some sort of relaxation. When the anxiety is reaching its peak, ask them to relax. Some sort of relaxation techniques they have to provide. You have to tell them. Then anxiety, slowly, by doing some sort of relaxation technique in the stage of second floor, the anxiety will be slowly reduces. Then after some 3 or 4 sessions, again, normal situation. Then finally, after some days or some weeks or some sessions, ask them to reach the 3rd floor. The moment they reach the 3rd floor, anxiety is maximum, it's high. Then the same procedure, whatever the procedure we followed in the 1st floor and 2nd floor. The moment they reach the place, the anxiety will be high. Though the anxiety will be in the peak stage, ask them to do some sort of relaxation techniques. They need to visualize themselves. Nothing is happening here. Why I feel so anxious? Nothing is there, nothing is there, nothing is there. So breathe in, breathe out, some sort of relaxation techniques. Ask them to practice in the 3rd floor also. So that is systematic desensitization. Sensitizing, that means whatever they're feeling, whatever their emotion, whatever their anxiety, desensitizing that. Systematically, stage-wise, that is the reason this technique is known as systematic desensitization technique. Okay. For example, any PTSD cases. PTSD means post-traumatic stress disorder. Post-traumatic stress disorder, PTSD. If any unwanted thing, any sudden issue happened to the same case or in the family or in a nearby place in the society. Post some sort of traumatic things are happened, traumatic situations are happened in their life. That is the reason they stress. So post-traumatic, that is the reason, post-traumatic stress disorder, PTSD. In PTSD also, anxiety. There are all the various anxiety cases. As I mentioned, panic disorders, PTSD cases, generalized anxiety disorder, then phobic cases, OCD cases. Okay, so whatever the various disorders may be, the root cause of this particular case is
Hello.
hello.
Yeah, now audible.
Yes, sir. Some here I'm out of place. That is the reason to some technical issues. Yeah. Then depressive cases. Okay. So the symptoms of depression also, we know that symptoms of depression. One is uh, sleeplessness. Okay. Then is another is some sort of it is behavioral, physiological, and psychological issues when they feel depressive conditions. Okay. Some sort of feeling sleeplessness, some sort of these cases of not focusing on any activity. Okay. Isolation, not mingling with others. Then not paying any attention on any activity. Yeah. Some sort of low feeling. Then some sort of this restlessness, insomnia, headache, frigidity, loss of appetite, dizziness, and some issues related to their other sexual aspects also. Okay. So in this depression case also, we have different, see, both anxiety or depression levels, or you can say depressive cases or anxiety cases, we need to see whether it is mild depressive state, moderate, or severe cases. Mild, moderate, and severe cases. Okay. So we have some tools also for depression and anxiety also. There are some tools of anxiety. For example, HAM-A, HAM-A. HAM-A means Hamilton, Hamilton, Hamilton scale of anxiety. Hamilton scale of anxiety, HAM-A. Got it? Another one is HAM-D, Hamilton scale of depression. In that scales, in the tools, it is clearly it will be mentioned whether it is severe case, whether it is mild case, whether it is moderate case. Depending on the cases, depending on the situation, and depending on the severity, we need to provide the counseling. So here, if there is a mild case, moderate case, and severe case, so as I mentioned, it is easy to find out the stage of the particular person by administrating this tool, by administrating the tool of Hamilton A, Hamilton B, and Hamilton D. Like Hamilton A means Hamilton anxiety scale. Hamilton D means Hamilton depression. Hamilton is the name of the person. Okay, who invented this tool, this scale, this scale. Okay, so here again the same thing. Whether they are in the denial state, though they are anxiety, though they are depressive cases, but they won't accept it. They will deny it. Got it?
Yes, sir.
So we need to check whether they are in the denial state, whether they are in the blaming others. Some cases, what happens? They won't accept it. They will tell that so anxiety is not with me. Anxiety is having some other reasons because of the family members, because of the colleagues. They won't accept. So in that case also, counseling is a major role. Counseling plays a vital role in improving their acceptance. Acceptance is a major aspect. Though the problem is having, if they don't have acceptance, they won't accept and they'll deny it. Yeah? Hello?
Yes, sir.
So
Yes,
we
sir.
need to, as I mentioned, any chronic illness cases, anxiety, depression, whatever the case may be, we have to check which stage they are in. Whether they are in the denial, shock, blaming others. Sometimes they'll blame the family members. They don't have any illness. The illness is because of this particular person. Like, as I mentioned, schizophrenic cases, delusions and hallucinations. They will think the problem is not with the case. It's not my problem. Audio hallucinations, visual hallucinations, delusions. So it may be physiological issues, psychological issues, emotional issues, as I mentioned, emotional issues may be there are sense. Yeah. When you identify these problems, the emotional issues, stage also we have to find out stage they are in. Yeah. You tell me what are you understand, what is really doubt, you have any issues? Hello.
Hello. Is it audible? Some problem.
Yes, sir. Audible.
Sorry, can you confirm? Is he continuing the talk?
I think the sir have uh, phone call.
Oh, I see. The question of audibility doesn't arise.
शिरो देशं सूर्यः पातु ललाटकम् आदित्यो लोचने पातु श्रुतिं पातु दिवाकरः घ्राणं पातु सदा भानुः मुखं पातु सदा रविः जिह्वां पातु जगन्नेत्रः कण्ठं पातु विभावसुः स्कन्धौ बृहस्पतिः पातु भुजौ पातु प्रभाकरः करावब्जकरः पातु हृदयं पातु भानुमान् मध्यं पातु सुसप्ताश्वो नाभिं पातु नभोमणिः द्वादशात्मा कटिं पातु सविता पातु शक्तिनी ऊरू पातु सुरश्रेष्ठो जानुनी पातु भास्करः जङ्घे मे पातु मार्ताण्डो गुल्फौ पातु दिशाम्
Sir, is it any break, sir?
I think sir is having some network issue and he is not available.
Oh, okay.
హలో. చెప్పండి. గచ్చిబౌలికి దగ్గర ఏది ఉంటే కిషన్ బాగ్ అది మాకు దూరము చెప్తే కదా, మసీదులు గీసులు దాటుకుంటూ పో అదేనట్నా, ఇంకా అంతకంటే దగ్గర లేదా? ఆహా. అట్లా కాదు, ఇప్పుడు నాకు ఇదే అడ్రస్ అక్కడ సరే మరి అంటే వాళ్ళకు తెలియదు అనమాట. ఇక వేరే నేను ఒకసారి అడుగుతూ ఇవ్వండి ఆయనకి. 2-3 సార్లు అక్కడే తీసుకున్నాము.
Manohar sir, please be on mute.